named Millie. She's about 10 weeks old and she's a French Bulldog. And I'm going to be talking to her owner today about risks that she has to her health because she's a Bulldog. When she gets older, we will talk about risks that she'll have as an adult dog and eventually as a senior dog. But for today, we're just going to talk about things that could go wrong while she's a puppy. So Bulldogs, whether they're French Bulldogs or English Bulldogs, are a breed that's called brachycephalic. They have a short, squishy nose. And that sets them up for problems with their respiratory system. So a lot of these dogs with the squished in face will have nostrils that are too small, and so they have trouble getting enough air in their nose. And then the air gets further into their throat and it hits the soft palate. The soft palate is the soft part of the roof of the mouth. And these little guys have the same amount of tissue as any other dog, but because their nose is squished, that tissue is bunched up and hangs down into their airway. So that soft palate can be too thick. It can also be too long. But we can surgically fix that. We can shorten it and we can, what's called debulking, we can make it less thick as well. So when Millie is a little bit older and we spay her, we're going to take a good look in the back of her throat and we're going to warn her owner ahead of time that, hey, we may have to do some surgical correction. And if not now, we may have to do it when she gets older because the palate tends to stretch and lengthen with time as well. So she needs to be aware of that before we actually spay Millie. Other problems that you'll get from their face being too short is that their teeth often don't line up very well. So you can see from this Bulldog picture, you can see a little bit of that lower incisor there. They often have a lower jaw that's a little bit too long. And then when the teeth don't line up right, they can have problems with their chewing and with how their teeth line up. Millie's lucky that way. She has very good alignment. Her upper and lower jaw are perfectly lined up, but we'll still keep an eye on it as her adult teeth come in. They start losing their baby teeth at about 4 months of age, and the adult teeth are fully in by 6 months. Again, their face is too short, so their teeth end up crowded and often crooked and sideways, and so they have more problems with periodontal disease than the average dog, and sometimes we actually have to extract a tooth or two that's simply just in the way and squished. Another problem that you can have with these any breed that's got a round or dome-shaped head is hydrocephalus. That's water on the brain. Their skull bones are supposed to fuse by the time they are adopted to their new home. Right on the top of her head, she has what's called an open fontanelle. I can feel where the bones haven't quite met up. And that's a defect in the skull, and sometimes that causes fluid to build up on the brain, and then they can end up brain damaged. So we'll be watching for that as her brain grows and her skull grows to make sure that she doesn't have any symptoms that her brain's not working properly. And that would usually be a puppy that's not learning very fast. They don't seem very smart. Sometimes they'll have seizures. So far Millie has not shown any sign of anything that serious. Other problems that we have come with the back end. So little dogs with short, kind of bowed legs often have kneecaps that don't stay in position very well, and hers is a little bit loose, and we'll be keeping an eye on that as she gets older as well. Sometimes those have to be surgically repaired, otherwise they end up with a lot of arthritis in their knee because that kneecap keeps rubbing and popping on and off where it shouldn't be going. Sometimes they will also tear the cruciate ligament in their knee, and so sooner or later in her life we may end up having some knee problems. Usually I'm going to start these little guys on glucosamine supplements as soon as they hit adult age, and that's going to help protect the knee from arthritis and damage from that slightly loose kneecap. What else? What else do we talk about? Yeah? Other problems that these guys can have, again, because of the shape of their skull and the shape of their face, they're prone to eye ulcers. Their eyeballs kind of stick out a little bit more than a normal shaped dog head. And so I'm going to tell clients that own these dogs to not let them ride with their head out the car window because that's going to increase their risk for eye injury. And any time in their life, if they start squinting, watery eye, red sore eye, call right away because that's a painful thing if they get an ulcer in their eye. The other eye problem that they will get when they're puppies that mom needs to watch out for is called cherry eye. In people, we just have a little bit of pink at the corner of our eye, but dogs and cats have a whole nother flap that's called the third eyelid that they can bring up to protect their eye. And in that flap is a gland that produces about a third of the amount of tear fluid that they produce. So that gland helps keep their eyes nice and moist, but that gland is prone in these guys with the short face to get inflamed and pop out of place. And so you may wake up one day and your dog will have this big cherry-like blob in the corner of the eye. It's not an emergency that you need to panic over. We'll need to see it, but it's not something that you need to go to the emergency clinic in the middle of the night if you notice it. Sometimes we can use some eye ointment and the gland will go back down where it's supposed to be, but a lot of times we have to do surgery to tuck that gland back down inside the eye. Luckily, a lot of times the cherry eye will happen about the same age as we spay or neuter, so a lot of times we can combine surgery if we have to and do both things at the same time.